Welcome to the Operatory Podcast, the podcast about burying the dinosaurs in dentistry, moving past outdated technology and procedures to find a better way. Today we're going to switch it up a little bit. Normally I'm the person that's talking and doing the interviewing, but today we have a special guest interviewer of me, Jayden Bell from Dental Coach USA. And Jayden interviewed me as I'm honored to be part of Dental Coach USA as the technology coach. And so if you want more information about different ways to implement many services within your dental practice, from financial to consulting, and then of course I do some technology consulting with Dental Coach USA, go to dentalcoachusa.com. I'm really honored to present to you the interview that I did with Jayden Bell. Thank you.
Hey, this is Jayden with Dental Coach USA. I'm here with our coach, Bryan Laskin, who's our dental upgrade coach. So Bryan, thank you so much for joining me today. Bryan, we're so excited for our clients to have this opportunity to learn more about your incredible services.
Oh, thank you. Yeah, I love what you're doing with Dental Coach USA. I'm just honored to be part of it. Thanks.
Awesome. Well, thanks so much, Bryan. So let me begin by filling everyone in a little bit about who you are. So Dr. Bryan Laskin has been at the forefront of technology in the dental industry for over 20 years. So Dr. Laskin's mission is to bury the dinosaurs in dentistry, setting aside outdated technology systems and perspectives so we can allow our teams in care to reach new heights. As founder and CEO of Operability, creators of Opera DDS, Opera VR, as well as the Operatory podcast, Dr. Laskin maintains a keen focus on improving the lives of patients throughout the integration of technology and teamwork. Dr. Laskin serves as Chief Innovation Officer at Dental Care Alliance, owner and dentist at Lake Minnetonka Dental, and founder of Upgrade Dental. As a partner in several other companies, including Toothabs, TalentShip, Evergreen, and Quickly, Dr. Laskin's focus is developing the next solutions for healthcare. Dr. Laskin serves as counsel to many of the leading companies in the dental industry, spending hundreds of hours each year educating their teams on enhancing the dental experience by transforming how dentistry is delivered to patients. A member of several local and national work groups on electronic privacy, security, and standardization. Dr. Laskin also helps shape the future of regulations within the dental industry. So honestly, after reading your bio, I think the first question I should start off with is just, when do you sleep? Because it does not seem like you sleep very often.
Yeah, a lot of people say that. It's all about, it's not about, it's really about being very efficient with your time, obviously, and just have a great team of A players that I work with where we can just get a lot done, I think.
Yeah.
This is great.
Well, honestly, you play such an innovative role with all the companies that you've created for the dental community. It seems like in today's world, dentistry, your companies play such a major part of helping dentists to grow their practice. With all these incredible services that you provide, what is it that has been your catalyst to get you to play such a significant role in the dental world?
I think that's a great question. I think the catalyst is really, for me, it's about transforming the patient experience. I think that going to work, I'm kind of a sensitive guy, and I absorb people's anxiety. And for me to be able to help do what I can to really transform the way people view dentistry, it just really irritates me that people come to the practice saying, I hate being here, right? And I think the core of really what I've been trying to do with leveraging technology over the course of the last 20 years is really being able to elevate the patient experience.
I love that. That's awesome. So let's kind of bring it back to the beginning of your career a little bit and tell us, what is your philosophy of practicing dentistry?
It's my philosophy, again, is about upping the patient experience by leveraging two things: our teams and our technology. And those two are hand in hand. Frankly, I look at technology as part of the team, because our dental practice team members, if you have really good A players, they love interacting with people. They don't like things like paperwork that we can automate through technology. And so if we take this sort of mundane, soul-sucking, boring work that a lot of people are forced to do in the dental practice and push it to technology, then our team member, when we attract, retain the best team members and allow them to do what they do best, which is interacting with patients.
I love that. That's awesome. So obviously you have lots of experience. So with you having practiced dentistry for over 20 years, what would you say is the most important thing you've learned to growing a successful practice?
The first thing I learned in dental school by reading a book called The $1 Million Practice was the importance of a painless injection. And so it's like the one topic in dental school that I mastered was pain management. And I think that really jump-started my career. And from there, I've been really layering on top of how do we really make it so that people coming to the dental practice have a better experience than they imagined the last time they could come in. And every time a patient comes to my practice, I want there to be a little bit of a thought when they're leaving the practice going, that was easier, better than I thought it was, than it would be.
Yeah.
Easy to do with new patients because the expectations are so low. But even when you have a patient, you've had a practice for 15 years, I want that patient coming in to leave going, boy, that was better than I thought it could be.
Yeah, that's fantastic. So let's kind of look on the other side a little bit. So I'm sure you faced many challenges throughout your career. What do you feel is the biggest challenge in dental offices today, and how can the average dentist overcome this challenge?
Well, I think we're in a unique point in time. Not unique, but a point in time that doesn't come every week, every year. And I like to call it the Great Reset. I had my practice. I thought it was, chiseled in stone. Turned out it was sketched out on an Etch-a-Sketch. And then COVID came along and shook the Etch-a-Sketch.
Yeah.
And that's a challenge, but it's also an opportunity. We get to look at, and you mentioned this prior when you were telling me about Dental Coach USA. What I love about it is you're about envisioning what your practice could be, the practice of your dreams. And the challenge and the opportunity is that we have a great reset right now. The opportunity is that you can actually decide what you want to do and chart that path. And so I think the biggest challenge that dentists, I believe, today have is doing nothing, burying their head in the sand and hoping that 6 months ago will return to practice. And the way to overcome that is by doing exactly what you're doing at Dental Coach USA. It's charting the path towards the practice of your dreams.
Got it. That's perfect. What a good analogy, though, with the Etch-a-Sketch. So obviously, with your, I think people already understand how much you're involved in, how much you do. But I feel like our listeners may not know you've taught CAD/CAM technology for 15 years to thousands of dental professionals. So what do you think is the biggest challenge dental professionals have getting the most out of technology?
Well, implementation is where technology goes to die in dentistry. And I think this isn't a dental issue. This is a planet Earth issue. I think there's a dramatic lack of leadership. And I don't think dentists understand how key leadership is to your practice. It's up to you to set the vision and repeat it to your team over and over again. And I see so many dentists that know what's best for their team, for their practice, but then they go to their team and they ask. And that person, the squeaky wheel who's going to complain about, boy, now I have to learn something new, wins, and then technology dies. I think dentists, leaders need to step up and be leaders and really lead the team. A lot of people need to be voluntold what to do, right? And I think people are looking for that. A players really want to work in a team where there's a true leader who's looks and goes, this is the practice of my dreams. I'm not going to be derailed by the weak link in the chain, right? They can either step up or step out.
That's perfect. So then what would be your recommendation on what technology should absolutely every dental practice put in place that most are not using today?
It's a great question. I think that's one of the core reasons why we developed Upgrade Dental. I see so much complexity in technology and dentistry being propagated, but there are some very basic things. We call it our level 1 with Upgrade Dental. It starts off with things like digital x-rays. If you're using film x-rays and you don't want to switch to digital x-rays, I got nothing for you. They're worse in every single way, right? I mean, I don't know how you can be practicing in dentistry in the year 2020 and still be okay with using film, frankly, personally.
Yeah.
Same thing is true with paperless forms versus a clipboard. Pre-COVID, 15% of dental practices were using paperless forms. Most were still passing a clipboard to a patient with a piece of paper, and it's just outdated technology. And if any dentist would actually process those forms themselves, they would recognize how laborious it is. And so really the upgrade at upgradedental.com, it's upgradedental.com/roadmap. We detail out what I believe every technology and the order you should implement them. And there's a core set, which are level 1s that I think every practice should use.
Love that. Perfect. So then for someone who has a technology challenged team, or maybe is challenged by technology themselves, how can they leverage technology to grow their practice?
It's really easy. Find simple solutions, things like paperless forms, digital x-rays. The technology is like a snowball. right? If you start small, you get a little win, then you go for a bigger win, and then a bigger win, and then before you know it, in a few years, you're doing implants with CT imaging and virtual reality and all sorts of crazy stuff that you would have never thought of before. But it all starts with the things that, like I talked about before, digital X-rays, paperless forms, things that every practice should be using.
Yeah. And you'd mentioned COVID earlier and kind of how it really dramatically changed up the dental world. So, Bryan, I'm sure you would agree that teledentistry has become a popular topic of conversation post-COVID. How do you think that teledentistry will be used by the average practice going forward from
Great question. And there's been a lot of, if you pay attention to the space at all, there's a lot of noise around teledentistry initially, and then it's kind of cooled off. And we've been leveraging teledentistry at my practice for several years. I think there's a little confusion around what teledentistry is, but there's really three main focuses of teledentistry that I think every practice should look to implement. Number one is triaging emergencies. Taking a phone call after hours is not good for anybody. So having a patient be able to send you a photo and you give a quick opinion is better in so many ways. Another way is bringing in new patients. So a patient that hasn't been to the dentist in 20 years probably knows that their teeth suck, right? They know that they have needs, but they're scared and they have shame and they don't know where to begin. So being able to give that high value new patient a safe, easy step to connect with your practice is really the way to bring in those patients that have fear and anxiety. And the third way is really ongoing monitoring of cases. You know, if you have an Invisalign case where that patient doesn't need to come in for IPR or for to check their attachments at an attachment, you can snap a picture, shoot a video, and really limit the in-office time. What's happening with teledentistry is our scope of communicating with patients is going outside our practice, and that's convenient for everybody. It makes us way more productive, way more convenient, and everybody knows if you do anything outside your house at all, it's all about convenience, right? And
here?
so like, teledentistry is a big piece, plays a big part of that.
Perfect. So let's talk about the education platform that you've launched, Upgrade Dental. So this came out before COVID hit, but the topics covered how to implement technology successfully in your practice are more applicable than ever. So could you describe what Upgrade Dental is and how it is different from other educational platforms?
Sure, thanks. The Upgrade Dental was really born after we did a study at my team of about 300 practices. And and their view of technology. And what was blatantly clear was there was a lot of confusion in the industry. And when I got out of dental school, there were some key people that I would listen to, like Gordon Christensen, Frank Spear, John Coyce, these people who had philosophies. And what I thought that we could bring is clarity to the technology space in dentistry. Specifically, what we do is we have a roadmap of every technology that you should implement in the order that you should implement them. And then there's a short 5 to 10 minute video where we describe what the technology is, why we got there, and then make a single recommendation for everything, so that even if you don't choose to use what we recommend, at least you know the reasoning that goes behind it, and you can make an educated guess as to what to do. And then we have supplemental materials that are made for things like an intraoral camera. We give a PDF on, you can give any assistant, any hygienist, on how to take quality intraoral photos for you as a dentist to review. We have lots of different educational platforms with the whole goal of demystifying and clarifying what technologies you should implement in what order and practices.
Awesome. So as you mentioned earlier, when it comes to implementing technology, you have a checklist in Upgrade Dental that walks teams through all the steps to success. So why is this important, and how can one checklist cover everything?
Well, there's some key things that I think people miss when they're implementing technology, because implementing technology is really about one thing. It's about managing change. And when you put no matter, even if you're going from paper forms to paperless forms, which is a super easy transition, there's a little bit of pain associated with that, right? You're going to have to figure something out. And so what we do with our checklist is we give you the guidelines of what to do for every piece of technology so that you can manage that change. You can, for example, you appointing a single champion who's responsible for this specific technology to be successful. not two people, it has to be one person. So if Sally's responsible for paperless forms, if anybody has a question, you go to Sally, right? And she's responsible for that. Then also things like why are we doing this? What's the size of the prize on the other end of this? So everybody knows kind of why we're doing this. And then how do we talk to patients about it? We have I think it's a 10 spot checklist that we go through that everybody's clear what we're doing, why we're doing it, and who's responsible. Very, very important, but I think we still, we use it at my practice, even though we've done it many, many times, because it's really those simple things that lead to a technology being successful or an expensive doormat, right?
Yeah, that's perfect. What a good description. So then, Bryan, as we're coming closer to the end, what is one technology that people don't know about that is transformative to dentistry?
Great question. I think me personally, my favorite technology that I've implemented recently is therapeutic virtual reality. We kind of pioneered it with Opera VR, and we're the only ones that do it right now in dentistry. And it's as effective as nitrous oxide with no drugs. The patient is wearing VR headsets, totally transports their awareness somewhere else other than the operatory. And like we've had half a dozen dentists on the news, and we've been featured in CNN Business, in Oprah Winfrey's magazine, and it's amazing that we have like thousands of patients like screaming how great it is from the rooftops, but it's not well known within dentistry yet. So that's on me. We've got to get the message out.
That is incredible. So Bryan, thank you so much for taking the time today. It's been such an informative conversation that I think will really change the mindset of many people watching. The way we always like to finish these interviews is by asking, what is some special offers you have for Dental Coach USA clients?
Well, a couple of them. Number one, if you want to have a 1 hour consultation for complimentary about technology in your practice, where we can talk about kind of where you are and set your own sort of personal roadmap, you can shoot us an email or shoot me an email at Bryan, Bryan .Laskin, Bryan.Laskin at operadds.com, operadds.com. And if you want to try any package at OperaDDS, we'll also give free setup and 30 days for free for any of our plans. So total risk-free trial. If you don't have paperless forms, I would definitely recommend you go to operadds.com/go, and we can get you set up for free. So those are the two offers that I'm excited to give the Dental Coach USA clients.
That's incredible. Bryan, thank you so much. I know you're going to be an incredible value to our clients, and I'm excited to have them start working with you. So thanks so much, Bryan.
Thank you. Appreciate it.